If you're self-employed, you've probably felt that mix of excitement and terror when you realize you're your own boss, but also your own HR department, which means figuring out health coverage all by yourself. As a solopreneur for the past 5 years, I've had to navigate this challenge for my family of 4. And in this video, I'll break down your best options for health coverage if you're self-employed, so you can protect your health and your wallet while running your business. Let's talk about why this matters first. Self-employment is on the rise, everybody. According to the Center for American Progress, about 16 million people in the US were self-employed in 2022, and that number is projected to keep growing. More people working for themselves means more people needing to figure out health coverage outside of an employer plan. And with the average employer-sponsored family health insurance premium hitting over $23,000 a year, this isn't something you can ignore. And going without health insurance is really risky. Medical debt is one of the leading causes of bankruptcy in the United States, with over 100 million Americans struggling with some form of medical debt. One accident or illness could wipe out years of hard work in your business. Let's go over your main options for health coverage when you're self-employed. Number 1, coverage through a spouse or partner. If your spouse or partner has an employer-sponsored plan, this can be the easiest and often most affordable option. Even if it costs more to add you, it's worth comparing against the other choices out there. Number 2, the marketplace, aka Healthcare.gov. This has been my personal choice for the past 5 years. The marketplace lets you compare plans side by side, and depending on your household income, you may qualify for premium tax credits that significantly reduce your monthly cost. For example, using the KFF subsidy calculator, a family of 4 in Michigan with a $100,000 household income might receive around $400 per month in premium tax credits. That's nearly $5,000 in annual savings. Exact credits vary by county, ages, tobacco status, and the local benchmark plan. And they change with policy updates, so plug your details into the KFF calculator for an accurate estimate. I'll put that link in the description below. With the recent passage of the One Big Beautiful Bill Act, subsidies may be reduced for some families starting next year. KFF estimates that changes to the ACA marketplaces could result in 8.2 million more people becoming uninsured. For my family of 4, our marketplace plan costs around $600 per month with a subsidy as of the time of this recording. It's provided us with a solid coverage. In fact, it's the same plan I had with my corporate job, and it has allowed me to keep running my business without interruption. And when you're self-employed, you don't have an HR person or a benefits department like I used to in my corporate life. You end up being the HR department. That's why I'm happy that I found Gusto for my payroll and my HR solutions. Their back-end system makes it easy to incorporate my healthcare benefits into my payroll, and because it's automated, I can rest easy knowing that it's done right. Right now, Gusto is offering $100 after you run your first payroll. It's a limited time offer, and it may not last that long. Check it out using the links below or visit marriagekidsandmoney.com/Gusto. Using those links provides us with a commission, so thank you so much for considering it, as that revenue helps this channel grow. Number 3, private health insurance. You can also shop directly through private insurers or a broker. This route can make sense if you want specific network options, special plan features, or certain carriers that don't list on the marketplace. Note, if you go off the exchange for your policy, confirm in writing that your plan is ACA compliant and review the summary of benefits and coverage before you buy. Number 4, health share plans. Healthcare sharing ministries and similar arrangements are not insurance. Members pool funds to help with each other's medical costs, and monthly amounts are often lower than traditional premiums. Here are some more major caveats to understand. There is no legal guarantee of payment with health share plans. These programs are not bound by insurance laws, so they can decline to pay for a service even if you expected coverage. Pre-existing condition exclusions are common, sometimes for the first 12 to 24 months. Lifestyle or religious requirements also may apply. For example, no tobacco and limits on alcohol. Any violations can mean denied sharing in the plan. There's also a limited scope of benefits. Preventative care, maternity, mental health, and prescriptions can be excluded or capped at low levels. These health share plans can work for some budgets, but you're trading lower monthly costs for higher uncertainty. Be sure to read every page of the guidelines and ask how often and how quickly shares are actually paid. Number 5, Medicaid. If your business is still early and your income is lower, you might qualify for Medicaid, a joint federal-state program that offers free or low-cost coverage. Each state sets its own eligibility rules. Here in Michigan, where I live, a family of 4 can qualify with an income of about $37,000 per year as of this recording through a Healthy Michigan plan, which covers preventative care, prescriptions, hospital stays, and mental health services. With the One Big Beautiful Bill Act, states could see reduced federal funding pressures that lead to tighter eligibility or fewer benefits. This is part of why KFF projects millions more uninsured over the next few years. For self-employed folks with variable income, Medicaid can be a safety net in leaner months. Just track your income closely though. If you cross the threshold mid-year, move promptly to a marketplace plan to avoid gaps. And then number 6, Cobra. If you recently left a job to become self-employed, you may be able to extend your previous employer's coverage temporarily via Cobra. It's often expensive because you pay the full premium plus a small administrative fee, but it can be useful short-term while you evaluate other options. As a self-employed professional, health coverage is one of the biggest line items in your budget and one of the most important. The good news is you have options. For me, the marketplace has been the right fit, but your situation might lead you toward a spouse's plan, Medicaid, or private insurance. The key is to compare, get quotes, and run the numbers so you can make a confident choice. And remember, you don't have to juggle health benefits, payroll, and taxes all on your own. Gusto has been a huge help for me in streamlining everything for my solo business, from paying myself to making sure my health benefits are properly handled. And right now they're offering $100 after you run your first payroll, a limited time offer that may not be around forever. To see how Gusto can help you simplify your solopreneur life, check out the links below or visit marriagekidsandmoney.com/gusto. I'd love to hear from you. If you're self-employed, what's worked best for your health coverage? Drop your experience in the comments below so we can help each other out. This is Andy Hill signing off. Carpe diem.